Good evening, my dear doctors. I hope you all are doing well. So today's topic is vitamin D. Right now, if you see that 90% of people are there, a lot of people, if you check vitamin D, they are having deficiency of vitamin D. And vitamin D is not only a vitamin, it's also a hormone. And today we are going to discuss in short about the senses of vitamin D, how it is acting, and how it is sensitized from the sunlight. So point number one, question number one, which sunlight is important for the senses of vitamin D? Of course, it is ultraviolet rays, but which one, A or B? So that is ultraviolet B rays. So ultraviolet B rays, okay, they are maximum in mid-noon. I mean, from 10 a.m. to 2 p.m. So there is again a myth. People are thinking that early morning sunlight is good for vitamin D synthesis. No, early morning sunlight is good, but for serotonin synthesis, for vitamin D synthesis, it is mainly the noon. I mean, from 10 a.m. to 2 p.m. or 3 p.m. That is having maximum of ultraviolet B rays. So that is important for vitamin D synthesis. So when ultraviolet rays are falling on our skin, so what is the prerequisite of that? I mean, what is the precursor of vitamin D in the skin? So answer is 7-dehydrocholesterol. Okay. So in our skin, we are having 7-dehydrocholesterol. When ultraviolet B rays falls on the skin, 7-dehydrocholesterol converts into cholecalciferol, which is called as vitamin D3. So vitamin D3 is not an active form. Okay, 7-dehydrocholesterol will be converted into cholecalciferol only when ultraviolet B rays falls on the skin. Now, this cholecalciferol only when enters the liver. In the liver, okay, it will convert into 25 hydroxycholecalciferol. So in the skin, what is that? It is cholecalciferol from 7-dehydrocholesterol. But when it enters the liver, hydroxylation will happen and it will convert into 25 hydroxycholecalciferol. Okay, in the presence of hydroxylase enzyme. Now, it is also called as calcidiol. So please remember this point that 25 hydroxycholecalciferol is also called as calcidiol, and it is the major circulating form. I mean, maximum form will be calcidiol in the blood, and it is 25 hydroxycholecalciferol. Now, do you think it is active form? No, it is not an active form. So to be active calcitriol, what is the next step? And this is the kidney. Only in the kidney, in presence of 1-alpha hydroxylase and a very important hormone, the parathormone, in the presence of 1-alpha hydroxylase and in presence of parathormone into 125 dihydroxycholecalciferol. Okay, so now this is called as calcitriol, and this is the active component of vitamin D3. It is called as calcitriol. It has plenty of action. I will discuss today only in the short span of time. But let me clear first what is the flow chart. So once again, when ultraviolet rays, which ultraviolet rays? Ultraviolet B rays. When ultraviolet B rays, which are maximum in the mid-noon, around 10 a.m., 11 a.m., 12 or 1 p.m., 2 p.m., like that. So in the mid-noon, ultraviolet B are maximum. So when they are falling on the skin, 7-dehydrocholesterol, which is present in the skin, that will be converted into cholecalciferol. Cholecalciferol is called as vitamin D3. But vitamin D3 is not an active form. Only in the liver, in presence of hydroxylase enzyme, it will convert into 25 hydroxycholecalciferol. It will convert into 25 hydroxycholecalciferol. No, again, this is called as calcidiol. It is not calcitriol. It is called as calcidiol. And calcidiol is the major circulating form of vitamin D. It is found in maximum. Sorry. Okay. Sorry for the disturbance. So it is found in maximum amount. It is 25 hydroxycholecalciferol. In the liver, there is an enzyme called as 25 hydroxycholecalciferol, so that it will be formed in the kidney. Now, we are having 1-alpha hydroxylase. And only in presence of parathormone, it will be converted into 125 dihydroxycholecalciferol called as calcitriol. And this is the active form. So this is about the flowchart. How cholecalciferol convert into calcidiol, and how calcidiol converts into calcitriol, which is the active form. Now, what is the main function of vitamin D3? So let me discuss this point in a very important way, because calcium absorption from the kidney and intestine is dependent on vitamin D3. In case of intestine, it is only vitamin D3. In case of kidney, it is vitamin D3 and parathormone. Is this clear? So calcium can only be absorbed if there is vitamin D3, because on the luminal side, calcium will be absorbed by TRP, V6 and V5. And these are activated by vitamin D3, and that too calcitriol. And when it is absorbed from the luminal side, the second step is that calcium will bind with cal binding. And the third step is that calcium will be entering in the blood circulation via a exchanger called as sodium calcium exchanger. So once again, there are three steps of calcium absorption. On the luminal side, we are having sodium for calcium absorption, TRP, V6 and V5. Step number one. On the luminal side or apical side. When it will enter in the cell, this calcium will bind with cal binding. Cal binding. And the third step is that calcium will be absorbed in the blood by sodium calcium exchanger. There are three steps of calcium absorption, and all these three steps are dependent on vitamin D3 in the intestine. In the intestine. And in case of kidney, it will depend not only on vitamin D3, but also on parathormone. So this is the main function of vitamin D3 in calcium absorption. So this is how vitamin D3 is activated and its function. So one very important question for your exam and viva also, sometimes they ask, okay, in the blood, if you have enough calcium, you don't need calcium absorption, then what vitamin D3 will do? It will be useless. And for that, you need to remember one more step. Right now, I have told you calcidiol convert into 125 dihydroxy. Okay, that's called as calcitriol. Dihydroxycholecalciferol, called as calcitriol. But one very important step which usually missed by a lot of the students is that when we have enough calcium, whenever we are having enough calcium, in that particular case, calcidiol will not be converted into calcitriol, but it will convert into 125, no, 2425. Normally it is converted into 125, but if there is enough calcium, it will be converted into 2425 dihydroxy cholecalciferol. And that is very important because this is the inactive form. So if you have enough calcium, what is the need of vitamin D3? That is why nature has programmed one more step, and that step is that instead of conversion of calcidiol into calcitriol, it will be converted into 24, 25 hydroxy cholecalciferol, which is inactive. I hope this is clear. Now, please go to your book, Ganong or Gaitan or GK Pal, whatever book you are having, and please look into the diagram. I hope this will be absolutely clear to you. So this is it for today. Hope to meet you next Friday once again. Till then, bye-bye. Take care. All the very best.